Hope gives us reason not to give up. Hope gives us the belief in God's kingdom and eternal life is our happiness. And because we believe in this, it gives us the want to make everyone's life fair and give all equality. With hope giving us the want to make a better world, we can strengthen healthcare, but we need to work together in partnership to improve incomes and productivity. From the State University of New York at New Paltz, Diane J. Goodman said the three main sources to strengthen and motivate to improve healthcare for others are empathy, moral and spiritual values, and self-interest. The social injustice of healthcare is caused because not everyone has equal opportunity to receive healthcare. Over 60% of people who don't have healthcare are Latino and Black. This shows that in our society, discrimination is a big reason people didn't receive healthcare. When people don't have healthcare, the consequences of them not having it leads them to not be able to get medicine, trained surgeons, education, and jobs. It has been shown that in the Southwest and the Southeast there is a high demand for healthcare. In these parts of the United States, there's a high population of Latinos and Blacks. Some of the new healthcare acts have given hope to those in need, but it doesn't cover everyone. Many of these acts still don't help those who are in need, including the large population of Blacks and Latinos in the South. So while many people receive hope for a better life with the new reforms, many receive false hope because they will still not be covered. Many of those are Black and Latino. To make a difference, the government and people must come together. They must protect human rights while doing this, support community-based initiatives, and promote sustainable human development while strengthening the social safety net for those who are most vulnerable. To do this, they need hope that they can make a better world and better place for those who are in need of health care. The Obama healthcare reform bill helps the healthcare industry expand Medicaid and Medicare. The main reason for Obamacare is to make healthcare affordable for millions of Americans. The healthcare system that we have is unfair and unaffordable. The Affordable Care Act decreases the price, makes it a better quality, and protects the people's rights. This graph of America shows which states have the most uninsured people in them. Most are in the southeast and southwest. In the southwest is where most Latinos live, as well as the southeast. The most blacks in America also live in the southeast. This shows that the minority people in America don't receive health care as much.
Imagine if your drive to the doctor weren't a drive at all. If the line was over 3,000 people long. And even if you are seen, there's a good chance the medical supplies and medicines you need won't be available. Though low-cost treatments do exist. That's the challenge of improving access to healthcare in the developing world. As recently as 2008, diarrhea was one of the leading causes of child deaths worldwide. The most advanced therapy we have for tuberculosis was invented in the 1960s. Today, tuberculosis still kills nearly 2 million people a year. Infrastructure, the availability of doctors, the supply of medicine and vaccines all must be improved. Yet, even advances in these areas are only part of the solution. Research and development is needed to find better treatments. All players in global healthcare need to encourage cooperation, innovation, and investment in prevention. Great things happen when we do. 20 years ago, the World Health Organization made eradicating leprosy a priority. Working with global companies, national health systems, and local workers. This coordinated effort expanded access to health education, diagnosis, and free medicine. The result? 14 million people have been cured of leprosy. A comprehensive approach has also helped fight malaria. Countries that have increased the supply and use of mosquito bed nets while increasing the availability of newer, more effective medicines have seen malaria cases and deaths fall by 50%. And this is only the beginning of what we can achieve. No single organization can solve the access to healthcare problem. It's too big to solve alone. But with effective coordination, continued innovation, and a shared commitment, we can make a big difference. Together,